Preparing a pregnant patient for an MRI requires special consideration to ensure safety for both the mother and the fetus. Here are the key steps and recommendations. 1. Consultation and risk assessment. First, indication review. Confirm that MRI is essential and that other imaging modalities like ultrasound are insufficient. MRI in pregnancy is generally reserved for cases where the benefits outweigh the risks. Next, trimester consideration. MRI is often avoided in the first trimester unless absolutely necessary due to limited data on potential effects during early fetal development. Lastly, MRI with or without contrast. Avoid using gadolinium-based contrast agents as they cross the placenta and may pose risks. Non-contrast MRI is preferred unless the diagnosis is critical and the use of contrast is unavoidable. 2. Informed consent. Discuss potential risks and benefits. Ensure the patient is fully informed about the procedure, why it's necessary, and any potential risks. Document consent. In many facilities, written consent is obtained for pregnant patients undergoing MRI. Patient comfort and positioning are crucial during an MRI, especially for pregnant patients. Position the patient comfortably, usually supine or slightly tilted to reduce pressure on the vena cava. This can prevent hypertension and ensure proper circulation. Also, provide supportive padding like cushions, especially for patients in the later stages of pregnancy, to maintain comfort throughout the scan. Now let's talk about MRI machine parameters. It's important to use low SAR protocols. This minimizes the specific absorption rate, limiting exposure to radio frequency energy. Most facilities use SR limits well within safety standards. Additionally, opt for shorter sequences when possible. Faster imaging protocols can reduce the total scan time and limit exposure. Monitoring during the procedure is equally important. Regularly check in with the patient during the scan for comfort and any signs of distress. Ensure the room is well ventilated and cool, as overheating can increase discomfort for pregnant patients. After the MRI, it's essential to observe and follow up with the patient. Monitor the patient for any post-scan discomfort or concerns and provide follow-up instructions if needed. By carefully considering these steps, MRI for pregnant patients can be done safely when necessary, providing essential diagnostic information while minimizing potential risks.